Lymphoma is the most common cancer in dogs and humans. A new type of treatment for dogs with cancer is showing promise. Professor and researcher at the University of Missouri College of Veterinary Medicine, Bryan, joins us to share more on what they found and what they're learning. Jeffrey, good morning, and thank you for joining us.
Good morning. Thanks for having me on the show.
Glad to have you. So there was a dog named Sadie. How is she helping lead this research?
Sadie received a new type of treatment for dogs called CAR T cells. And CAR stands for chimeric antigen receptor, which is a fancy way of saying that we engineer a molecule into these cells that causes them to attack a particular molecule on the surface of cancer cells. In this case, the CD20 molecule on the surface of B lymphocytes. And these cells are designed to kill those cells whenever they find them. So they become engineered professional killer cells of these dogs' cancers.
What makes this treatment unique?
These are human cells that have been engineered to kill dog cells. So it's called a xenogeneic approach to treatment. And so rather than using Sadie's own cells like we do on the human side currently, which is extremely costly and time consuming, we're able to keep these cells in the freezer ready to treat any dog that has a cancer that expresses this molecule. This allows us to, one, administer them at the best time for the dog, and two, reduces the cost substantially because they can be manufactured in large quantities and are not made one-off for each patient.
How is Sadie doing now?
Sadie's doing very well. She experienced several months of a good remission from her CAR T cells, and she's now receiving chemotherapy to hopefully extend her quality of life for a good long time.
How can the results we've seen in dogs potentially help humans as well?
These cells also are engineered with a gene that lets us see them with a PET scan tracer, and this allows us to track them in the dog's body after we have injected them. So Sadie was scanned 1 day, 3 days, and 7 days after her treatment with the CAR T cells. Currently, very little is known about how these cells move within the body of the people who are treated with them, and whether those movements have a big impact on whether the treatment is successful or not. And so our goal with this study is to understand the trafficking of these cells within the patient's body and see if we can understand better what leads to success or failure with the treatment, so that in the end, we can be more successful treating both dogs and people with this approach.
People and pets, everybody winning. Thank you very much for joining us, Jeffrey. We hope you have a good rest of your morning.
You as well. Take care.